Hello, my name is Cate Lane. I'm the Director of Adolescents and Youth at Family Planning 2020. Thank you for the opportunity to discuss how FP 2020 is addressing the effects of COVID-19 on adolescents and young people. About a year ago, UNFPA convened the Nairobi Summit to make commitments to improve the sexual and reproductive health and rights of women and adolescents. This celebration of and recommitment to the 1994 ICPD affirmed the importance of addressing the sexual, reproductive health and rights of all adolescents and acknowledged the real diversity of adolescent lives and experiences. Within 4 months, however, all this positive and affirming language about adolescent sexuality and reproductive health was buried under the COVID-19 avalanche. As FP 2020 began to work with countries to protect FP products and programs, we began to see very little attention being paid to adolescents as countries developed their COVID-19 responses, despite fairly robust evidence of the vulnerabilities young people face during humanitarian and public health crises. Even worse in some ways was that where there was language directed at adolescents, the tone tended towards negative and scolding. As many of you likely see in your own countries, there are reports of increases in early marriage, as well as heightened vulnerabilities of adolescents to sexual abuse, violence, and transactional sex. These factors are highly influential in the occurrence of early and/or unintended pregnancy. We decided to reach out to Dr. Susan Sawyer at the International Association of Adolescent Health to explore their interest in co-authoring a statement to shine a spotlight on adolescent sexual and reproductive health and to recommend actions for healthcare providers who frequently see adolescents in their practices. We wanted to secure endorsements from frontline health workers such as obstetricians and gynecologists, midwives, general and family practitioners, pediatricians, pharmacists, and even medical students, who are also by definition youth, and to disseminate this statement through networks of professional associations. We aim to capitalize on the influence and authority that healthcare providers often hold in their communities to help ensure that young people's needs are not being overlooked. And not just for contraception, but for things like pre-exposure prophylaxis, post-exposure prophylaxis to prevent HIV, as well as social and mental health support. Paradoxically, COVID-19 provides an opportunity to interrupt a persistent cycle of inattention to adolescents. Health professionals, advocates, and youth leaders might wish to consider how this crisis could enable the more rapid introduction of supportive measures and actions that can be sustained beyond COVID. We proposed a few actions for healthcare providers to consider in their day-to-day activities, and I'll share a few of those with you now. One is to speak up for the inclusion and involvement of adolescents, as well as adolescent health and education experts in the development of any guidance documents related to COVID-19. Two, leave no youth behind. Make sure marginalized youth like adolescents who live with a disability, or LGBTQ youth, or underserved adolescents such as married teens are acknowledged. Advocate for the collection of age-disaggregated data so that we can better track the effect of the pandemic on young people and monitor other adolescent health concerns. Go out of your way to make sure young people can easily get good quality SRH information, products, and services. Provide easy access to contraception, especially emergency contraception and long-acting and reversible methods for girls who are vulnerable to unprotected sex or for young women who are sure they want to delay pregnancy. Help make methods easily available over the counter or easily administered by a pharmacist. Persist. Don't let up as the pandemic evolves or subsides. The work of an adolescent advocate is never done. So speak out on the need to systematically institutionalize adolescent responsive programs and service delivery approaches across multiple services and emerging new approaches such as telehealth. Be proactive. Community-level providers like pharmacists and community health workers often have frequent interactions with young people and can really do more to intentionally initiate conversations to assess need. Finally, convene. Parents, teachers, local leaders, and faith leaders are looking for expert guidance, and providers can provide such guidance. Facilitate dialogue and joint problem solving between adults and young people, and involve other sectors. Education comes to mind, as does labor. As we learn about COVID-19 every day, there is still a sense that adolescents aren't that vulnerable, so there's really not that need to pay much attention to them. Yet, it is increasingly clear that this pandemic means young people are experiencing new risks that they are unprepared for, and they are coping with the loss of critical protective factors such as school, peer networks, and supportive adults. Crises such as COVID-19 present us with an opportunity to think and problem solve differently. Frontline providers have unique interactions with and insights into young people and must bring those experiences to bear with decision makers as COVID-19 evolves. Thank you so much for this opportunity, and I wish you good studies.